So now I am demonstrating the wrist block on the left side. So I have marked the distal palmar crease, and this is the proximal palmar crease, and we have marked the all the three important tendons. So this is the flexor carpi radialis tendon here. This is the palmaris longus tendon. See, you can in between. Now these two tendons, the flexor carpi radialis, the palmaris longus tendon, the flexor carpi ulnaris tendon, we have marked the palpating the radial artery. This is the location of ulnar artery, and the landmark for the median nerve is just underneath the palmaris longus, or in between the flexor carpi radialis and palmaris longus, just deep to the volar fascia here. And one superficial branch is just underneath the skin in subcutaneous plane. And now for the ulnar, for the radial, I have for radial nerve block, I have marked the radial artery here, and this the circle indicates the point of entry. And here, just underneath the skin, we will infiltrate half ml of the solution, and from this point we will direct the needle dorsally like this in this direction to block the superficial branches. And for this we have marked another circle here on the medial side of the flexor carpi ulnaris tendon. From here I will insert the needle just underneath this tendon to block the ulnar nerve. After withdrawing it, direct the needle dorsally to block the superficial branches of the ulnar nerve. Okay, so I have taken a very thin needle, this 31 gauge needle I have taken, and I just raise a small blab here at this. So just pinch the skin and just raise at this line just एक बेटा छोटी सुई लगे बस, just pinch and lift this blab here, okay, at this dotted line. Now again here just lift the skin and do a intradermal and subcutaneous injection with a very fine 31 gauge needle, and that's enough. 1 point and 2 point and third point again at this level. Pinch the skin and then inject a few drops of the solution here. So all the 3 points I have. Now the needle, so this is the 26 gauge needle and 5 ml syringe. So for the median nerve block, this small needle is enough to block the median nerve from the previously anesthetized the skin wheel. From here just pinch it, so there won't be any pain to the patient, and the solution is also buffered by me. So now here pinch this. From here this is already anesthetized, so now pinch it here, aspirate, stabilize it, and aspirate and inject half ml of the solution here. This will block the superficial branch of the median nerve at this level. Now from here it is in between or underneath. Now so tilt this, and now you just pierce it. You will feel little bit the sensation of the deep fascia here. Now see, you can feel the resistance here. Now it's just gone inside. Inject it here, withdraw, and don't try to hurt the nerve. So only few ml off. So we are going just deep to it. So this much is enough, and just massage this. Now for the radial nerve, you have to change the needle. This is a small needle, so just change the needle and take a longer needle, that too of 1.5 inch long here. So this is the long 26 gauge needle. So now just press it. Now for the radial nerve block, just puncture the skin, just wait. Now for the radial nerve block, this I have marked here, so little drop is there, just wait. Point is previously anesthetized by few drops of local anesthetic solution. So now pinch the skin here pinch the skin here, so from the anesthetized point, and aspirate here, so don't puncture the radial artery. Inject a few drops here, and then from here you pass the needle dorsally. Just rotate the arm, rotate, modo bete. Inject in subcutaneous tissue, aspirate, and then inject here. And from here, you just insert the needle in subcutaneous plane, just lift it up like this. And aspirate and move the syringe on the dorsal aspect. Aspirate to avoid any puncture in the vein, and then go dorsally to block the superficial branches here. So this is long needle. Just lift the skin up and then block it. Yes. And that is enough. And then remove it. So this is the block of the superficial branches of the radial nerve going there. And then from this side, I will block the ulnar nerve. So now the ulnar nerve is just deep to the flexor carpi and medial to the ulnar artery. So now from this previously anesthetized point, insert the needle and go deep to the flexor carpi ulnaris tendon here. Now aspirate and then inject little amount of the solution. Go little deep because the artery is somewhere here. And be gentle, don't do any accidental intravascular injection. This is resistance free. Now this is deep to, basically the nerve is deep to the deep fascia. You can feel little resistance here. Yes, 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 yes. Now aspirate and then inject. Aspirate and then inject here. Now withdraw the needle and pass it subcutaneously. Inject in plane and then withdraw it and direct the needle in subcutaneous tissue and guide it dorsally. To block the superficial branches, aspirate and then inject. Aspirate and then inject. So aspirate and then inject. So this is the subcutaneous infiltration in a dorsal directions. So this is the complete block. Now this block is complete. Analyzing the outcome of this block, he says the whole of the palm. बेटा ये भारी आ गया? आ गया. यहाँ पर आ गया? आ गया. यहाँ पे. So this is the distribution of the median nerve. This is the distribution of ulnar nerve. He says whole of this palm get blocked. Okay. He says that the back side of the thumb is also anesthetized, but the dorsal aspect of the hand is not anesthetized. It means we have infiltrated and some of the branches get spared from it. We have infiltrated this area, we will go little beyond it. In the same way, we have infiltrated up to this mark, we will go little beyond it because the branches is somewhere here. Okay, so this is little modification, and just from here, just turn it, and this area is already anesthetized, so there won't be any pain. So from here, inject in subcutaneous plane. दर्द तो नहीं बेटा यहाँ? नहीं, because this area is already anesthetized. So now pass the needle up to this directions. So up to here you can go. हाँ ठीक है बेटा. So now only this much area you need to block it. Alright? Now this is enough, and in the same way you just enhance this area also. We have blocked up to this point. Take another prick. This is already anesthetized. There won't be any pain. So go little dorsal. Alright? So infiltrate this area, and that is enough. Enough. So we have completed this. Now from this 1 ml of the solution, just change the needle and repeat the nerve block by injecting half ml of the solution here and there. So this will enhance the anesthesia time. So from the same anesthetized point, from here, go in between this and the nerve lies underneath or just lateral here, and then just feel and see, this is the fascia which we are feeling. The needle is popping over it. Now be gentle and then, yes, pop is there, and then inject here half ml of the solution, and that is enough. Repeating this block for now. Again repeat the block, the ulnar nerve, to enhance its analgesia time. From the same point, insert the needle, because this is again painless. Go deep to the flexor carpi ulnaris tendon. Feel the deep fascia here. Now this is again popping here. Just you can feel, yes, it is gone inside, and aspirate and inject half ml of the solution. So we have just repeated median and the ulnar block. So total volume I have taken in whole of the list block is 5 ml. Right? 2 nerves we have repeated to enhance the analgesia time. The wrist block is complete. So we will ask what happens on the dorsal aspect also, whether this also get anesthetized or not. So this method of complete wrist block nearly successful in 100% of the cases, even if there is any anatomical variations of the nerves. Now he says that previously only this area was anesthetized, so be just this much of the infiltration is actually needed. So now he says whole of this dorsum, this aspect is radial aspect get anesthetized. He also says that this remaining part here is also anesthetized. Okay, so now this is complete wrist block using 5 ml of the buffered solution that contains 4 ml 2% lidocaine with adaline, that to 1 to 2 lakhs dilution, and 2 ml of bupivacaine 0.5% and 1 ml of buffered solution. So this is the complete block in this child, and now I will do work in this area.